welcome back for our final presentation. And it's a presentation that's a topic that's near and dear to our hearts here at Wisconsin Parkinson Association, and that's exercise and Parkinson's disease. So hopefully it's something you're involved in, and if not, I think Kristen's gonna get you excited about it. So I gave Kristen's introduction already, but Kristen Musser is going to be leading us in this presentation. Welcome, Kristen.
Thank you, and thank you for having me. Yes, exercise is something that is very important, and something that, as a physical therapist, I'm very passionate about. And especially when it comes to Parkinson's disease, it's like the number one, really best thing you can do. And it's the best thing you can do for yourself to really help with Parkinson's. So I'll try not to get on too much of a soapbox about it, but we'll kind of go into everything, and hopefully we can give you some good ideas and answer lots of questions. And because once again, it is such an important thing to be able to do. So the cardinal signs of Parkinson's disease, which I'm sure many of you know or have these, are the bradykinesia, which is the slowness of movement, the muscle rigidity or a lot of stiffness, having a resting tremor, and then gait disorders and postural instability are huge as well in Parkinson's disease. Typically, there's a typical Parkinson's gait pattern. Things that we notice when you're walking. A lot of times this is how people are diagnosed with Parkinson's. It's because of this, their gait pattern. They have that small kind of shuffling steps when they're walking, that fascinating gait where you are trying to go, but you kind of are stuck. And so your body kind of starts moving a little bit. Reduced arm swing, which also results in reduced trunk mobility when you're walking. Kind of that forward stoop posture. Freezing episodes are very common, especially more in advanced Parkinson's patients. And then people also have a tendency to fall backwards. Things that may kind of worsen when you may worsen symptoms of Parkinson's disease. And I know Maria kind of gotten into a little bit about this as far as falls go, but the whole stress or anxiety that can definitely increase your symptoms. If you're being hurried, I know Maria really talked about that and trying to slow down a little bit. If you're fatigued, sometimes your symptoms can be worse. If you're sick or you have some sort of illness that, just already gives you extra fatigue, or you're just not feeling great, that can make your symptoms worse. Medication, the timing, of medication can be huge with Parkinson's disease. So if the medication is starting to wear off, a lot of times your symptoms are worse during those times. Another thing is if you miss your daily exercise, because daily exercise is extremely important for Parkinson's disease. There are lots of different treatment options for Parkinson's disease. As we know, there's no necessarily cure for it, but there's things that you can do to help. Medication is one. Deep brain stimulation is another that can help. Once again, it usually takes the right candidate for that. But other things that you can do is exercise, physical therapy, occupational therapy, and speech therapy. Those can all help just make more of a specific program for you as a patient. The benefits of exercise. This is something that we could go on and on about, because of all things, all diagnoses, exercise is really the best as far as for Parkinson's disease, it's the best thing you can do. It can protect remaining dopamine neurons. It can help to restore and improve connections and signal pathways in the brain. It can also strengthen the use of undamaged pathways, and it can slow that motor deterioration. So it can truly slow the progress of Parkinson's disease. You want to intervene before the pathways are lost. So the sooner you start exercising, the better, but it's never too late to exercise. No matter how severe it is, there's still ways that you can exercise. So it is most effective in the early stages, but once again, regardless of how late you start, it doesn't matter. There's always something you can do that can help. The studies have really found that the exercises need to be intense and repetitive. Those are kind of the biggest things. Sometimes I think the repetitiveness can get a little boring, but it's going to help you the most. The benefits of exercise: you can improve the ease of motion. You can kind of combat some of that stiffness and slowness. For instance, ease of motion, if you're having troubles doing certain things, it can help, like getting out of a chair. Doing exercise can help with that. It can improve your speed and step length with walking. It can improve ability to complete activities of daily living, even simple things, getting out of bed, rolling over in bed, stuff like that. Exercise can help with all those things. I mean, even, trying to cook a meal or do dishes. I mean, anything that you're having troubles with, exercise can help with those things. It can decrease risk of falls, which, as Maria just told you, something we really want to help prevent. It can decrease those freezing episodes. There's different mental and physical things that you can do to kind of help with those freezing episodes. And so, yeah, the more you exercise, the more you work on it, the more it can help. It can improve posture and help you have more of that upright posture, so you're not forward as much. Exercise can help decrease depression and anxiety, and this is in all patient populations, not even Parkinson's, just Parkinson's disease. Exercise can improve your sleep. It can also help decrease caregiver burden. So if you feel, like your spouse or someone is having to do a lot more around the house and you want to try to help out more, I mean, if you work on certain things with exercise, it can definitely help with that. It can also help to decrease cognitive decline. It can help improve your attention and also your memory. So lots and lots of things that it can benefit. Different components of exercise: stretching, strengthening, and then aerobic conditioning. So stretching, this is not always something we focus a lot on because, like we said, a lot of the exercises with Parkinson's disease needs to be high intensity and repetitive for it to be super effective, but stretching in itself can be great. Some people do yoga or just even some general stretching. Stretching just in itself just helps you feel better. It can increase your range of motion. It can help maintain some of that posture. It can help protect against muscle strains and sprains. So especially if you are doing some of these more intense repetitive exercises, it can kind of help prevent any injuries. It improves your circulation, and it can also release some of that muscle tension. So especially if you're stressed or anything like that, stretching can help with all of that. Strengthening. Strengthening can help you stand up straighter. It can help make tasks easier, like we were talking about with getting out of the chair. It can really help if you consistently work on getting stronger. Getting out of a chair can be so much easier, but you just have to work on strengthening, which strengthening can take time. It doesn't happen overnight. I always tell patients a good 6 to 8 weeks of strengthening to really make a difference can help. And it's also, one of those things, if you don't use it, you lose it. So you got to keep up with it. Strengthening can help make bones stronger. It can help fight the overall effects of aging, and just in general can help movement be easier. Like we keep going back to the chair, but even going, having to use the bathroom, getting on the toilet, having to get out of bed, having just walking, it can help with all these things, just make things a lot easier for you. And then the benefits of aerobic conditioning. Aerobic conditioning, meaning walking, biking, whatever, you enjoy doing is what we're referring to. And that can strengthen your heart and lungs. It can improve your stamina and endurance. It helps to reduce stress. It can overall improve your mood and help with depression. It can control blood pressure, high cholesterol, diabetes, which, those are just comorbidities that if we can help with those, that can also help with the Parkinson's disease. It can also make things like doing household chores easier and things around the house, or if you're doing, outdoor work, if you have more of a aerobic capacity, it's just going to be a lot easier for you to be able to do. So physical therapy goals. A lot of times people come to physical therapy when they have Parkinson's disease just to kind of be able to specifically work on your goals. I know Maria touched on this a little bit, that we treat you as a person. We don't just treat you as a disease. We don't say, oh, they're here for Parkinson's disease, we're going to give them this, this, and this. We want to get to know you and figure out what you're having difficulties doing specifically, what you want to do specifically as a therapist or as a patient, what you want to get back to. And then as much as we can, we're going to try to help you get back to those things. But as a physical therapist, our main goals are to help you move easier, increase gait speed. A lot of times with Parkinson's disease, your gait is a little bit slower, and we want to get that gait going a little bit faster, because that can help you it can help reduce falls, and it can help just get things done easier throughout the day. We do want to, like we said, decrease those falls risks. I know Maria talked a lot about it. It's just something that is extremely important. Help improve just your overall physical fitness, and also help improve secondary symptoms, musculoskeletal, cardio, respiratory, deconditioning. I mean, I hardly ever see just a patient here for just their Parkinson's disease. A lot of times they have back pain, or they have, other issues going on that we also work with. And, because like I said, we're treating you as a whole person, and we want to help you with all those different things that you have going on. A couple tips to help prevent or reduce freezing. You can use visual cues, like a laser line in a certain walker. Sometimes that can help, or just even visual cues, like if there's like a line in the carpet, or you see a spot in the carpet, you can kind of focus on that spot to try to help you to get to that next step. Some people use auditory cues. You can use a metronome or music on your phone. You can set that up. You can do a little bit of like humming or singing or counting to yourself to kind of stop that freezing. You can do like a mental rehearsal, or visualize stepping over a line or stepping towards a particular distance. So you can kind of, almost think that sometimes we'll practice in PT, like we have you step over things. And then when you come to certain circumstances where you're freezing, you can just pretend like your picture that you're stepping over this thing that we work on. You can also do a little weight shifting from side to side to try to kind of get your body going. Otherwise, you can try different movements, raise your arms, or marching in place. Those are all different things that can really help to reduce those freezing episodes. So I'm sure a lot of you have heard about BIG, and it's the Big and Loud program that it's been really effective for patients with Parkinson's disease. And it is the loud part is for speech therapists, and the big part is for physical therapists. And this was developed by Lee Silverman in the mid 1980s. And it's a specific protocol where it's 4 times a week for 4 weeks and for 60 minutes at a time. So it's a big commitment. Sometimes it's hard because sometimes insurance prevents people from being able to do this, and sometimes time or other commitments. So that can be challenging, but it's been found to be a very effective program for people. And it really focuses on kind of those big movements, intense movements in that repetition. And it really has, like I said, it's been very effective. And there are certain people that are therapists that do the big program. I know most of us here are trained in it. We don't do it a lot here just because of, like I said, that time commitment, and insurance kind of doesn't always allow for that much therapy in that short of time. There's lots of other different things that it seems very popular now to have different things you can work on, different programs. And there's the power program. That's a huge one that people do. Rock Steady Boxing is another one. I feel like boxing has really gotten a lot of press lately with Parkinson's disease. There's different dance programs for Parkinson's disease. And I know with this, with the pandemic right now, it's hard to do, go to a lot of different places, but there are different programs for different people, because you also want to make sure that you're finding something that interests you and that you enjoy doing, because it is a lifelong thing you want to do, this exercise and movement. And so you need to find something that you're kind of passionate about. FIT program, that's what we do here at the Neuroscience group. It's functional individualized training. We work, once again, it goes back to working specifically with the patient and what they need and what they want. And we combine a lot of different, from different kind of programs. We do from the big program, from the power, from yoga, just, we have a lot of different training, and we kind of gear it specifically towards the patient to help find what works for them. So it's really specific to your individual needs. And we have a program twice a week, or we did before COVID, twice a week, where people could come in and sign up for pretty, it's not a very expensive fee, but just so we kind of limited the class and had a certain people. But yeah, twice a week for 45 minutes, and a therapist would teach this class, which is great. Some of these classes are great because you can get to know people and work with people. But you definitely don't need a class, and especially right now, you don't need a class to move and exercise. There's so many different things you can do at home on your own. And hopefully one day we can start the class again when COVID is over. But for now, really working on stuff on your own is huge. Another idea, aerobic walking is a really good one. A lot of times we have people use walking sticks, and that's great, because not only does it can help with your balance, but it can also, it just helps get your arms going, and it can really help you with your focusing on those big steps when you're walking. Some people do treadmill high intensity walking. Otherwise, can be tandem force cycling. Cycling has been found to be really effective as well. But yeah, you want to make sure that it's kind of that high intensity, and you're really forcing it. Whole body vibration, there's been limited research, but it could be useful. And then Tai Chi can also be useful too, especially for balance things and everything like that. So a couple different things that kind of help patients kind of get moving. And I mean, there's, like I said, a million different things you can do. And it's just that intensity and that repetitive motion. Those are kind of the most important things. But sometimes certain things that can kind of help are, especially people like that are having troubles like buttons and stuff like that. Sometimes you can do these hand flicks, and it kind of helps get things moving a little bit. And then try doing a button or getting dressed if you're having troubles with that. Clock turning, which I don't know you probably can't see my feet. So what clock turning, if these are my feet, you're basically kind of, when you're turning, you kind of turn one foot and then the other, and turning around to kind of help be a little bit safer. Sit to stands. It's a simple movement that we do all the time, but it's such an important one to do. So, and working on, and hopefully you can see me, but just kind of going up nice and fast and down. Don't want to lose my chair. But yeah, really, you don't use a chair with wheels, because we don't want you to fall. But really using a forceful sit to stand and doing repetitive sit to stand motions, that can really be a great thing to do, and a couple times a day, really, to do it. Step and reach forward, sidewards, and backwards. So working on large steps is huge with Parkinson's disease, because our goal is to help you to move bigger. And so by doing these repetitive forward motions or stepping, it can really be helpful. And you can do it. I mean, if your safety is key, the most important. So if you need to hold on, you can definitely hold on, depending on your level. And this is why sometimes working with physical therapists can be helpful, because they can kind of help you figure out what's safe and what's not. But if you don't feel safe at all, holding on with both hands to a countertop or something really sturdy can really be helpful. But taking these large, once again, I'll try to show you, but kind of large forward steps, kind of moving forward, getting your arms moving, your whole body. And then you can do some side steps, and then you can do backward steps. And once again, you would do repetitive So, you don't want to do just one, you want to do what you can do. And each patient's going to probably be different. So if you can, you may only be able to start with doing a couple, but you want to try to work up doing, 10, 15, 20 even. But it can really be helpful. Calf stretching too is really good. Stretching out that can help with just balance and walking and everything like that. Kind of with calf stretching, kind of stand against the wall and stretch your lower legs. I don't think I'll really be able to show that one, but I think there might be a picture coming up. This here is a picture of just kind of those big forward steps that you can work on that I just tried to show you. But yeah, taking a big step forward. Once again, if you can, get those arms moving. But if you are at all at a fall risk, making sure that you're holding on for safety purposes. Because even if you're holding on, it's still effective. So this is the forward step, holding onto a chair. I prefer something more sturdy than a chair, like a countertop or something like that, because I think that's definitely safer. But once again, it kind of depends on your level, but safety is the most important. And then you can do the big side steps and really getting your whole body moving. That's the most important. It was intense, really be intense and big movements. Here's the side stepping, once again, holding on. And once again, I feel like that chair is it's not necessarily a stable thing to hold on to. So having something stable is best. You can kind of rock forward, reaching, so kind of moving back and forth with your leg. That can be helpful too, kind of working on almost the walking pattern. Oh, yes, this is the calf stretch we were talking about. Stretching out your calf can be really helpful because if your ankles don't have that range of motion, that can really lead to falls. It can just cause issues with gait, with walking, being able to have like a good walking pattern. It can really help with that. So stretching, and typically with stretching, I tell people the longer you hold it, the better. I mean, really even, 45 seconds to 60 seconds, and about 3 times on each side, once or twice a day is going to be most effective. And it takes time for the things to help or loosen up, but it really can be effective. So take home points. The biggest thing is move. There's lots of different activities you can do, but it is finding something that is important to you that you can keep up with, because it is something you do have to do on a regular basis, whether it be, walking or biking or, doing some of these exercises. But the more you do, the better, because it can really be helpful. It says, we talked about communicating with providers. So if you feel like you need therapy, to have that kind of one-on-one to get you going on a program, I would highly recommend it, because it can definitely get you in a good program. But it is finding something that you enjoy and that you will keep up with. So with this quote here, it says, it's not about perfect, it's about effort. And when you bring that effort every single day, that's where transformation happens. And that's how change occurs, which I think is a great kind of quote. All right. So yes, that's it for me. And like I said, all I can emphasize is just trying to move a lot. And like I said, those intense movements and repetitive movements it's going to be the most helpful for you. So if you have any questions, please let me know.
Hi, Kristen. Can you hear me okay?
Yes, I can.
Okay, great. Great job. Thank you so much. Yeah, we're with you. We're all in on exercise, and it's been so good to see the prevalence of it in the Parkinson's world over the past 5-10 years, just getting more and more popular. So thanks for helping us out on that topic today. One of the things that struck me in your talking points was just the sooner we start, the better, right? So start today. But yep. Along with that, it's never too late, right? People Correct. Should not say, oh, I didn't do it these past 5 years, right? They still can be starting at any point and get benefit.
Exactly. And even if if you're someone that's been good about it and you miss a couple days, just get back to it, right? I mean, yeah.
So did have a couple of questions for you. Somebody asked, what should the balance be between aerobic and resistance training in somebody who's a functional Parkinson's patient? Should we focus on muscular strength or endurance?
I would probably focus, I mean, some strengthening is important, but really endurance is going to be the best thing, and working on, I mean, I really focus a lot on walking with patients and making these big movements of walking. Biking has also been really found to be helpful. And then some of these like different exercises where you're doing more of these big movements, because typically within Parkinson's disease, strength is not necessarily an issue. Most of my patients come in and they're strong. That's not the problem. It's a movement disorder.
Right.
So you want to be like actually moving, and not just, so I think that's definitely most important.
Great. Here's one we hear quite a bit. How can I encourage my spouse to stay active? Any tips there?
It's hard. I mean, I think that's really hard, because I do feel that in order for someone to make change, right, it kind of has to come from within, and they have to be the ones that want to do it. I mean, you could, if you can find, if you exercise with your spouse, maybe that would help them, because sometimes, people just need that encouragement. So maybe you can set aside time that both of you can do it together. Or once again, it's hard with the pandemic because we can't be going a lot of places. So, but if you can help find something that they would be interested in, you can definitely show them, the data and let them know, that it can really be helpful. But yeah, it's hard because you can just think all you can do is encourage them, but it's also that fine line of not wanting to nag too much, because they have to want to do it themselves. But maybe, doing it together, I think, could be really helpful. Yeah.
I love the idea of them doing it together too, which is big. I know in some of the programs we do is just having both folks present and participating. It's a good idea.
Yep.
Can you talk about the differences between a walking stick and a walker?
Yep. So walking stick, a walker would be like where you're actually holding on like the 2 or 4 wheels, and walking stick. So walker is going to be much more stable. If someone is having a lot of issues of falling and everything like that, then I would recommend a walker. And then like a walking stick. So if you're using the 2 walking sticks, which is a lot of times what we recommend, what that can do, it's not necessarily the walking sticks. I mean, they can help with balance a little bit, but it's not as much, with balance, but it's even just getting those arms and that trunk moving with walking. So with a walker, you're not going to get as much movement with that trunk. And, but if you're having falls and it's going to get you to move the walker, then we want that. Right. Walking stick, a lot of times, even if you're really high level and you don't even need any type of assisted device, sometimes those walking sticks can just help you as a reminder to get those arms and that trunk moving, just to get your whole body. Because a lot of times with patients with Parkinson's disease, when they're walking, they don't use their upper body as much. And so we want to get everything moving.
Yeah.
Is that
definitely answers it. Yeah, great. I'm wondering, in your experience, if you had any, when do you choose physical therapy over exercise?
So you don't necessarily have to choose one over the other, right? I mean, you can do both, and you can do in at any time. I mean, a lot of times with patients with Parkinson's disease, and I tell people this, that you may come to me for a couple of weeks, get in a good program, but then things start to decline. You have to come back in a year. I think that you definitely don't have to choose one or the other. I think that both can be effective, and no matter even how high level you are in the beginning, if you just need to get ideas specifically for you, go to physical therapy. But always exercise, right? Yeah. No matter what. And then if you just feel like you need a little bit of guidance or a little bit of help, or if you are falling more, or if something is happening, then definitely physical therapy. But I think that I don't see like my patients that have Parkinson's disease, I don't see them every week forever. It's like usually we get you on a program, and then you go home and work on this, and then if you need anything, come back and we'll progress, or we'll change things as needed.
Yeah. So in your experience, have you seen people come in with worries or myths about exercise that stop them from doing it, that you can dispel, things they might worry about that aren't true?
Yeah, I think people, there's always different things. I mean, people are concerned about the falls or concerned about, and stuff like that. And regardless, we can work with you. We can find ways for you to I mean, even people that are honestly, spend a lot of their day in the wheelchair. I mean, we still can find ways to exercise. It's just all about, and that's where, physical therapy is nice because we can focus just on you and what your needs are. So it's just, everyone needs no matter what your limitations are. And people that have pain, then they worry too. They're like, oh, I've got pain, so I can't exercise. Or, but it's like, okay, well, we need to work with you and kind of figure that out, because sometimes movement can actually help reduce that pain, and just help you get further with your exercise.
Yeah, great. I think we have one final question. Can exercise help address cognitive issues related to Parkinson's?
It can definitely. Exercise has been found with or without Parkinson's disease. It can help with cognitive issues and memory and everything like that. It can definitely make changes within your brain, and it can be helpful. Mm-hmm.
Yeah, you did a great job covering we all know the physical benefits, but there's a ton of mental health benefits as well. So
yes, 100%. And once again, there's varying levels of everything. And will exercise fix things 100%? No, but it can definitely help in so many ways.
Yeah, and I think you and Maria and Daisy all touched on that. It's got to be tailored to your needs and your abilities. So it's
correct. Mm-hmm.
Great message. Well, thank you so much for your time. Really appreciate you covering a really important topic for us. So thanks for that.
No problem. Anytime. Thank you.
Right. Take care.